Okay, so we saw that video. I think I'll start with you, Ingrid. In what ways are patient needs different, and how in the Norwegian Cancer Society do we deal with those?
Yeah, so thank you. I thought it was a really strong patient story here leading up to this panel discussion, and it's so complex. You know, she really reflects upon what you could call a full-time job, maneuvering both her diagnosis, her treatment, the healthcare system, and of course her well-being, which is really, really important. And she seemed like a really resourceful and strong woman, but all patients are not that resourceful. And in the Norwegian Cancer Society, we say that no cancer patient should be left alone maneuvering all this. So it's really important to understand that it's really complex. It's really, the needs are very individual, and the things that you have to have in place to meet those needs are, of course, time, and time is really something that we lack within the healthcare system. It's less and less time on the healthcare professionals. We need a good support system, and if you don't have that around you, we need, you know, NGOs that can support you, and the Norwegian Cancer Society does that with information support, advocacy work, and so on. And of course, you need to see the entire patient, so not just, you know, the medical side of things, not just maneuvering the healthcare system, but giving enough and personalized information and having the right psychological support during the whole patient pathway is really key. So I thought it was a really strong way to introduce this panel, and I'm looking forward to discuss this more in depth.
Great. Okay. Well, I'd like to come back to that relationship between sort of the traditional health system, as it were, the biomedical part of the health system, and then things that charities, NGOs, etc., can provide to provide that whole rounded care. We can come back to that. Carina, you've referenced psychosocial care in the notes you've sent me as a critical component, which is, we know this from my work with Allcan, which is an organisation that looks at, you know, we've done patient surveys, and this is almost universally a failing within our system, is that psychosocial element of care. Perhaps you could sort of describe what that means, but then, you know, how those gaps can be filled, or what those gaps are and how they can be filled.
Thank you. Yeah, and I think you said it quite right. It is universally a big failing, not only in oncology, but we saw it during the COVID pandemic. All of a sudden, everybody was speaking about psychosocial care and psychological and emotional support, also for especially young people. But when it comes to a complex disease like cancer, and it doesn't really matter, we have been chatting about that before the panel, it doesn't really so much matter how old the person is or in which age range they are diagnosed. But especially, and this is where I come from, from pediatric oncology, working with young people who are diagnosed, what we can see is in an age where you normally are not confronted with the finiteness or affinity of your life, this is a huge cut, that you have to deal with interruptions, disruptions of your development, of your physical development, of your emotional, psychological development. You cannot go to school anymore. You have to stop your education. You have to maybe step out of work. Your relationships are disrupted. And on top of that, you are hospitalized. You are fighting a potentially fatal disease. Your whole body changes. You are getting chemotherapy, surgery, you have radiation, you lose your hair, all the side effects. So in a phase where your body as a teenager, as an adolescent or child is changing anyway, and you have to cope with this and develop a positive body image, all of this is disrupted. And then there is no support, there is no guidance, because, and Eileen also, she said, quantity of life is the focus of our healthcare systems, but not so much the quality and the context that you as a person fighting such a disease is living in. And what we can see with all our member organizations who are working in the countries on the ground with the treatment centers, with the patients, our healthcare systems are just not equipped to provide the psychosocial support that is needed in such a complex setting. And this is where we definitely have to do better as a society, because it cannot be that provision of psychosocial care, of emotional support, is a matter of philanthropy, of donations and charity organizations ensuring that our healthcare systems are supported with that.
Okay. Well, I want to come back to how that is achieved within, in particular in Europe, where we have publicly funded systems in the main. I know in my country, in the UK, there is a shortage even for mental health services. There's a severe lack of availability of CBT and of other therapies. So I'd like to come back to how that's achieved. I think, Emilie, I think maybe the role of industry in addressing personalized needs, and as I said, we can talk about, I think it's perfectly legitimate to talk about personalized medicines as part of this, because that is about looking at the individual. So you may want to address that, you may want to to talk about some of these broader aspects as well, but I'll leave that to you.
Yes, absolutely.
Yeah.
So as pharma, we are very happy to be at the table, and I think the approach that we are taking compared to 10 to 20 years ago is completely different. The idea really is to build partnerships and partnership with patient associations to really listen to the voice of the patient and to make sure that we go much beyond the treatment. And it means having the right patient support programs, the right disease awareness campaigns, especially when it comes to rare forms of cancer, because this is what we are focused on. Very small patient population, time to diagnose that is extremely long, and then treatment options that are made available, but that needs to be right for each patient. So this is really what we are looking into and how we address that every day.
Okay. And if I sort of take that a little further, so what sort of partnerships does that entail?
So as pharma companies, we cannot talk to the patients directly.
Yeah.
So we have to have a second line listening. And what we do is that we build partnership with the patient association to really understand what are the patient needs and how we can support them better. Whether it will be through patient support programs, so it means that patients that have been diagnosed with a disease can have access to hotlines with nurses, with psychological support, whether they are on treatment or decide not to be on treatment, that are available for them and for their families, because cancer is personal to the patient, but also to everybody surrounding the patient. And the announcement of the disease has normally and very often a huge impact about everybody surrounding the patient. And what we see in the disease that we are focused on, which is a rare form of T-cell lymphoma, is that it has a very important impact on the social life of the patient, because it's a blood cancer that has an expression in the skin. And it means that your look is completely different, back to what Carina was saying. As suddenly your social life is completely impacted. People are not daring to go to the supermarket anymore. People are not daring to go out because others will look at them and will question what they have. So it's how can we address that? Yes, there is obviously the treatment and new treatment in very rare form of cancer that are really progressing the survival rate, but there is also everything else, and how do we make the quality of life for their patients much better, and how can we give them the support to go through the impact of this disease on them and how they look and how they feel about it.
Yeah. Okay, thank you. So maybe now I'll speak to Andrei, who's joining us virtually, and I think maybe this is getting to the question of how we improve these things, and maybe you could speak to what is happening in Romania and the role of government, and maybe examples from Romania of how we're addressing these broader aspects of care for each individual.
Good morning, everybody. First of all, I would like to say that I'm very sorry that I could not be present physically there. Some emergencies going on here, so I had to take care to be present in Bucharest. But getting back to your question, I really believe that things that have been mentioned before are the key to providing excellence in healthcare, in cancer care. The title is as perfect as can be. Cancer is personal, which means that patients' needs, patients' interests vary and change from one day to another. Technology and medicine progresses very quickly, very fast. Unfortunately, healthcare systems, healthcare institutions, society as a whole cannot keep up with the speed of technology's development, science, the way the science moves forward. So the best way to align everything that medicine and science provides in one hand with the actual patient's need is to have an actual listening, active listening process, a good communication. It's exactly what my previous panelist colleagues have mentioned, the fact that we have to improve this communication between all the stakeholders in a way that we understand exactly what the priorities are today, keeping in mind that medicine, technology move very fast and, well, society and healthcare central and local administration institutions do not have they are not at the same, they cannot move at the same speed. So it's extremely important from my point of view to always be connected to the patient's voice, to have an active listening process, the best way to find out what exactly patients need today.
Okay. I guess one important question around all of this is around just the capacity and the workforce that's available to support patients in these broader aspects like There's a whole lot we could explore. I also wanted to talk about pain relief and symptom control as well, but let's stick with this psychosocial aspect for now. But you know, is how, because this is it, how specialized is the workforce required for psychosocial care in cancer as opposed to a range of diseases? Can we leverage? Is there a need just for upskilling of mental health and psychosocial support across the board that we could then leverage for cancer care? Or does it have to be specific, or is it a mixture of both? And really, where do we stand in Europe in terms of that workforce? So there's a lot in there, but I you know, I'm open to, you know, any of you sort of responding to that. Yeah.
So, so in the Norwegian Cancer Society, we have this patient panel board. We can ask all sorts of questions, and the response that we get from this panel is that as long as you're within the hospital sector, there's psychological support. What happens is when you go back to your local community, or if you have to battle with your late effects of cancer, then you're left almost all by yourself. So it's different within different stages of cancer. So you're in Norway, quite well taken care of as long as you're within the hospital sector. And then you're really left alone if you have to battle your late effects and so on. And there's also a big gap between, you know, your health, the part of your life that's surrounded on health and your work life. So battling, you know, health and your workspace, that's even more complicated. And then you get really little support with your rights, both your patient rights and your work life rights. So I think there's different needs of support within, you know, the pathway that you going through as a patient.
Yeah, and we do see European efforts to, so the right to be forgotten, for example, where, you know, after a certain number of years post-treatment and post-remission, you're now considered cured, as it were, from a legal sort of standpoint and from an insurance standpoint and the rest of it. But yes, I mean, that's been my personal experience as well from people that I know. It's that once you leave the biomedical, the hospital setting, you are kind of out on your own, battling. And I guess another question, Actually, I wanted to ask about on that video. On that video, there was a lot of discussion around. I mean, and I've seen this with people, including people who are really driven by data and evidence. But when they fall ill, then there's a turning to alternative therapies and things that, you know, as a doctor, one would think, hang on, what's that all about? That's a very natural and understandable response. What's the role, do you think, of publicly funded health systems to support unevidenced or alternative therapies, which provide a lot of, at the very least, I mean, some of them are not evidence because we don't have the trials, but at the very least provide a lot of psychological support for patients. I mean, how do you respond to that sort of situation, either in your you know, as a cancer society or as a health system? Do you think we should respond to that psychological need to turn to hope? Any thoughts on that one?
So I can take it, and Carina, I'm sure you'll have many things to add. So I think it's critical. We see in the area where we're operating in, it's a skin cancer, it's a blood cancer, it's a lymphoma, and sometimes, you know, treatments have tremendous effect on the markers, but it has no effect on the skin. So the patient still have affection of its skin, and the patients are reporting that even though, you know, the results and the testing are really good from a blood perspective, that his life continues to be impacted. And then I think it's where, you know, it's a discussion that needs to happen between the patient, the healthcare, and the healthcare, the HCPs, to really understand what is the right, you know, treatment for that patient moving forward. Should we continue to cure the blood? Do we need to look at the skin? Do we need to be more on combination therapies? Do we need to be more on psychological support? What is truly impacting the life of the patient at this point in time of his disease? Mm-hmm. And I think there is not one response, it's a complete response, and we need to really take a holistic view where the multidisciplinary approach is really the new norm in terms of treating the cancer. And when we think about multidisciplinary, it goes with the HCP, the nurse, the GP, but also the physiotherapists, the psychologists, the psychiatrists if needed, to really look at the multidimensional elements of the cancer. So it's very complex, and I think Andrei was talking about it, that institution and healthcare system is slower to move. So there will still be gaps until we have the appropriate response for each patient, addressing the multifactorial elements of cancer and the feeling of each patient facing the disease. But I think it's efforts, if we collectively look into it, that will really make a full transformation on how we are treating and taking care about patients with cancer in the future.
I've got some specific questions. If you have any questions, please put your hand up. Can I just take the questions that are on there, and then I'll come to you, Mike, in a second. Thank you for putting your hand up. It's around workforce again, and I'm just going to slightly adapt the question. Does any place that you know of, I'll ask you, I'll ask all of you as well, any place that we know have specific training in psycho-oncology or psychosocial support for cancer patients? Specific training to create a workforce. So say you go into mental health, or say you go into as a psychotherapist or something like that, is there a specific course that one could do to support cancer patients? Does anyone know of such a thing? Matty, you're going to answer this question, or going to ask a different one?
I'll answer this question, and I'll make also another comment. There is the International Psycho-Oncology Society. There are various branches throughout the world, and including many European countries. They do have specific trainings. In different countries, there are different solutions. And it's not only about psycho-oncologists, it's also about the training of oncologists, radiation oncologists, medical oncologists, surgical oncologists, and how to talk to the patients. In some countries, this is taught in special courses, and it's mandatory in some countries like Switzerland. In others, unfortunately, nothing is being done, so it's a big issue. So that's the answer. Just the comment that I would like to make is that you mentioned the fact that there are issues in our patients who are not in the hospital system anymore. This is very much country dependent again. In some countries, there's a lot of support. There are lots of networks to support patients, and others, unfortunately, that's not true.
But at least one would expect in the countries where there are those networks that it would be signposted in the hospital stay. And I've noticed that doesn't happen many times in the National Health Service in the UK. One is not signposted to support for this or for other diseases like Parkinson's, etc. You have to go and look for yourself. Is that your experience as well, or how is it in Norway? How is it in...
Yeah, so in Norway, the government are trying to make a pathway that goes from the hospital to the local community level, and then there's a sign off. There's supposed to be a sign off conversation with the patient that really helps the patient to know who to take contact with when you get back home, and that interview is also supposed to make sure that you get every aspect that is important for the patient, and then you deliver on the information. But when we do the research in Norway, almost none of the patients experience this. So,
right.
So it's this way on paper, but not in practice.
Right.
So we have a lot of work to do to get the pathway to continue when you get out of the hospital.
And what about your experience across childhood cancers?
So across childhood cancers, childhood cancer is a rare disease. So, and then you have many different cancer types within this already rare disease. So each childhood cancer again is rare in itself. And so with this, we have a very small population of childhood and adolescent cancer patients. So this is also our experience. So in the hospital, the attention is, of course, bigger. The support system is here. But then if you go home, or if you have finished your treatment and now are in follow-up care, if there is follow-up care in your country or in the region that you live in, then when it comes to psychosocial support, you are quite on your own. And then also depending where you live. So do you live in the surroundings of a big city? Might be easier to find someone. The question then again is this something that is supported financially by the healthcare system, or is it something that you have to pay out of your own pocket? Then if you live in more rural areas, find a psychologist or a psychotherapist or a social worker or an ergotherapist or occupational therapist that has experience with pediatric cancers. And here I would like to come back to the specialization. Do we need a specialized workforce? In my opinion, yes, we do.
Okay. Andrei, I want to bring you in. I mean, do you have what's the situation there in Romania? What are you trying to build in terms of that linkage?
Well, obviously, in every health care system, resources are limited. So basically, it's in order to have the best possible results, it's a question of managing the limited resources that you have and setting up priorities. I'm very happy to say that last year, Romania has approved the first national beating cancer plan, which basically looks at the whole situation in this way. We have these resources, this is the ongoing situation, and these are our objectives for the next couple of years. Of course, it's a very complex process, but it's a first major step ahead in having a modern and up-to-date, let's say, approach to such a difficult context coming out of COVID, where the whole healthcare system has suffered different kinds of modifications. So basically, the best way to do it is to try to develop an organized plan, taking into consideration your existing resources, and then trying to identify as best as possible the real needs of the patient, of the general population, and having a plan as detailed as possible with clear deadlines and clear responsible for each and every milestone of this plan. So I would say that this is the major achievement of the Romanian government and the Romanian parliament for the healthcare system as a whole, but mainly and especially for the cancer patients.
Thank you. Mike, you had a question. Can we get the microphone?
Thank you very much. Mike Zatka, the Cancer Awareness Trust, charity building the cancer platform. We heard Eileen describe a range of tools that made a big difference to her cancer journey, and the panel picked up on the fact that not all patients feel that confident or that empowered to, to steer their treatment and their well-being. What does the panel see as the biggest barriers to patients being able to educate themselves and find the things that are going to make a difference to them, whether that's clinical, psychosocial, or supportive care?
Go ahead.
Yeah, sure. Thank you. That's a great question. I think what our experience with cancer patients is that they get too little information, and it's really hard to grasp what is said. And I think it's quite easy to understand that the information is quite medically related. There's too little questions about what's important to you. There's not enough, points of information so that you can go home and process what's important to me and then get back to your physicians and discuss this further. So in our patient panel board, there is almost 50% that says that they did not get enough information, that they did not understand the information that they received, and then it's really hard to grasp, what is really my options and where can I find out what's important to me. And then there's also the point of navigating the healthcare system, which is really hard. You have to almost be an expert to navigate the healthcare system. And so it's not just the medical side, it's also navigating, so I think really, and today this is tough, but going forward into the future that is more personalized, then you don't even have that relevant information on the organ that the cancer is in, because it's the biomarkers that are the most important, aspect to look upon. And then you go from today's situation where the information is quite broad and patient group specific into a future where you need to be even personalized in your communication, because your cancer is also, the treatment is personalized. So I think this is key to really talk more about and address. How do you, inform a patient in a way that is understandable and with enough points in time that you can really be able to make the decisions with your healthcare professionals, and of course also moving towards a future with more personalized communication. So I think this is really key going forward, or else I think you will even more patients feeling that they're left alone and lost in this system.
Anyone else want to comment on that question?
Yeah, I would like very much, because I do think that communication from the healthcare professionals towards the patients, the survivors, or their parents is the first and most important step in receiving information. And what we see are, we see many things, but two things that I would like to mention in terms of open communication and providing information. At the beginning of treatment, we often hear that there is a barrier from the healthcare professionals to give too much information at the beginning in order to not scare away the patients, the families, because we know this treatment is necessary to hopefully cure the patient. But then there is, of course, also the notion that families might turn away from these very aggressive treatments towards alternative and not evidence-based treatments that are available. So this is one thing, so the balancing out between how much information do I have to give so that it's still okay and also processable for the families. And then the other thing is when it comes to late effects. So here what we see is that many survivors say, I would have liked to be better informed about the late effects that I might be facing. And on the other hand, there is the barrier on the side of the healthcare professionals who don't want to scare the survivors with things that could happen but don't have to happen. And so here is so this is what we are advocating for, really open communication. Survivors, patients must be aware also of what could happen, because otherwise you cannot be, sensible to what you have to look out for and take care of your follow-up care so that you stick to the follow-up regimen that you have to take. And also it gives you the power to do something about it, the control. You can seek help. And so also the comment before that we heard from the audience about the communication training, I think this is why this is so important for the medical part as well as the psychosocial part, so that the workforce is specialized in how do I communicate these things in a way so that that is empowering and not scaring.
I'm going to ask, Emilie, do you want to comment? And then Andrei, do you want to comment on how we empower patients to... so Emilie first, and then I'll come to you, Andrei.
Yeah, and I can add to what Carina and Ingrid have just said. When it comes to very rare form of cancer, the mechanism of the disease is extremely complex, and it's very difficult for the healthcare professional, the oncologist, to share the details of the disease and what will happen to the patient, because there is also an awful lot of uncertainty. Will the treatment option work? How long will it work? Do we need to switch? And it's, I don't want to say unpredictable, but there is a level of uncertainty that is difficult to share. So there is a component of complexity of the disease itself, especially when it comes to certain forms of cancer, plus an element of unpredictability about, the response of the patient to the treatment. So this creates, even more complexity for the patient to navigate his disease and the knowledge around it, because the knowledge is only what we know today, and the knowledge is increasing every day. So there is also a response time that we need to adapt to. When you are in the HCP office and you get an announcement of a diagnosis or a treatment option, there is a moment of shock, there is a moment of questioning, and then you go back home and you are left with your questions, the question that may be more around how will I cope with it, what will be the impact on my life. And that's why having those patient support programs up and running, where the patients can call somebody, having a human interaction with another person, even if it's only online, to take up the questions, answer it in a different framework that is not sitting face-to-face with an HCP, is critical. So the answer is not only training the HCP and the oncologist to, give everything away because they don't have time. I think we have to acknowledge that, and we want them as well to do some science and knowledge to progress science. But how can we have other mechanisms outside of the HCP office to support the patient at a different time and at the right time for the patient when he or she feels to call and get the answer to that question? And I think we need to have also this time element that we take into account in the way we address the patient needs.
Yes. Andrei, yes.
Well, I would like to address this very important topic by exemplifying what we have managed to do in Romania. As acting president of the National Reimbursement House, I was appointed a month ago. So the first thing that I did is to set up a permanent communication mechanism with all the patients' organizations from Romania. This means that I'm looking forward to develop this collaboration in two different dimensions. First of all, let's look at a way in which we can improve the relationship between patient and the healthcare system, the human interaction within the healthcare system, and so on. So let's look at the health policies that are directly oriented towards the patient. That's the first thing. But the second thing is also to fix different kinds of local problems that might appear without being, a general or the most important topic of the day or of the week of the top priority of the healthcare system. Because at the end of the day, from my point of view, for a patient, what is really important is to have a direct and easy access to healthcare, and to be able to understand really what's the pathway forward from the moment of the diagnosis. So from my experience, most of the challenges come not from general systemic problems or issues, but from local, individual challenges that are a lot easier to solve. But we need to know about these local difficulties in accessing healthcare. I don't know, let's take some examples. For instance, it's far, I mean, I don't know, in a certain county, there is an issue with a CT or with a MRI, with the imagistic facilities at the big hospital, and all those patients there have a difficulty in accessing, I don't know, diagnosis or follow-up imagistic processes. Let's look at this, maybe not top priorities, but let's look at also these local challenges that patients are facing in accessing healthcare, the healthcare services, medical services, and with this we can increase the quality of the services that patients actually receive at the end of the day. I think it's very important to have a focus also on this, not only to look for the big and systemic challenges. My example in Romania is this. I managed to initiate this organism, this committee. So basically, it's an ongoing communication, not at the top level of the healthcare institutions, but at the mid-level, where patients really can communicate all these issues and all these problems with responsible with persons and with directors from all the institutions that are able actually to fix all these problems.
Okay, thank you. So I think there's a need for sort of strategic planning and things on paper, but then actually for implementation, it's individuals that really count, and individual institutions, etc., and organizations working together. I get that. Did we have another question from the floor? I think there was one there first. I'm sorry, I'm just taking them in order, if that's okay. This gentleman here. We've got about 4 minutes left, so we will see how far we get with yours.
Good morning, everyone. My name is Irfan. I'm a psycho-oncologist and a global health advocate.
Great.
So I will come back to the previous question about training the workforce for psycho-oncology.
Yeah.
Let's get real. I still see that cancer is seen more as a biomedical thing, unfortunately not a holistic. So my question regarding that is that in a lot of European countries, there are trainings, especially for psycho-oncology. But because Europe is so driven and there are so amazing and promising approaches like Horizon Europe and Beating Cancer Plan, I would like to, it's not a question, but maybe a comment, that I would be humbled in coming years that psycho-oncology is one of the a more dominant dimension of cancer. Because at the end of the day, we just don't want to treat it a disease. It's a human being with family, with emotions, and also the clinical team, because they also share a lot of burden, because it's cancer and it's always challenging. Thank you. Okay,
that's a great comment.
Yep.
Thank you. Okay, I mean, any reflections of that other than an agreement? But okay, well, we'll move. Your question, yes. We've got 3 minutes left, so we might have to be quite quick with this one.
Okay, I'll go really quickly.
Okay.
Oliver Kemp from Prostate Cancer Research. I just want to come back to the comments that were made around providing patient information at the right time. I think one of the things that we saw when we started investigating this question was the huge amount of jargon that exists. When patients start to do a deep dive, 4 pages on hormone therapies, people don't read them. 51% of the UK classified as low health literacy. So we tried to take all of that information and put it into ways that were really understandable, infographics, animations, remove all the jargon, spread rather than metastases, try and make sure that all the different patient options were very available and could be explored in their own time after they come out of that shock that was just referred to about that kind of a 10-minute meeting where you've suddenly got to go through 20 different treatment options is not possible and nobody's taking anything in. I think the other thing that we really got to take away from it is how do we work with a very overstretched healthcare system? And I think that's a big challenge for patient organizations. how do we develop programs that automatically assume that the healthcare system is stretched? And therefore, how do we develop things that patients can go away, use, and then reintegrate themselves back into the healthcare system at a later date, having got all that information, having got the right questions to ask, and can go back into those meetings feeling informed and empowered?
Great. I mean, that's again a comment, but I think that I'm interested in that point. I mean, do you assume, I quite like that in a sense, that we can assume that the health systems are going to be overstretched forever? Is that an assumption that you will all make and then therefore try to build stuff around the health system? Or is it a question of trying to grab these precious resources and put them into the health system? How do you approach that from your different standpoints?
So we already assume that the healthcare system will be stretched for a number of years. And that's why it's really, I think it's quite strange that we don't work in partnership even more, because, you know, the Cancer Society aspect of this is that we have the cancer helpline, we have a lot of support systems around the patients, but the healthcare system doesn't refer to it. So I think the key here is actually partnership, as you said, and trying to build really strong partnerships, knowing which partner does what in informing the patient and supporting the patient. And I really think that the Mission on Cancer is helping us to do that. In Norway, we have this Cancer Mission Hub, and we work together in a huge collaboration, looking upon, you know, EU's Beating Cancer Plan as a whole, and what can we do, and who does what. So I think really going forward, we have to work even closer. That's the only way to solve this. It's complex, and it's going to be more patients. So I think it's key to just assume that the workload will be more and not less going forward, and then we have to do it together.
Okay. We're pretty much out of time. Any very, very quick comments, but we really must be quick. Anything to say? I mean, I think you've talked about partnerships already. You've talked about... Andrei, do you, just one last question to you, what your reflection on that. In Romania, you've got the formal health system, are you forging sort of links with charities, NGOs to provide that broader care because it's not providable within the system?
I totally agree with my fellow panelists. The key to having the best medical services to patients is communication and proactive listening. Let's hear the voice of the patients. Let's stay in touch with patients' organization, with all the important actors, and together, if we set up the priorities, given the fact that healthcare systems will always be overstretched, limited resources, limited human and budgetary resources. So let's identify together what are our priorities, given the fact that resources are very, very limited.
Okay, thank you. All right, well, that's us out of time, but thank you. That was a really, really good discussion, and I wish we had... Well, we are exploring more of that in future panels, and more of this sort of thing. So thank you very much indeed. Thank you.